Now you can observe here. So the femoral vessels, that is femoral artery and vein, are covered by a funnel shaped sleeve of the fascia here. Funnel shaped sleeve of the fascia, that is femoral sheath, which encloses the upper 3 to 4 centimeter of the femoral vessels in femoral triangle, and it is formed by the downward extensions of the two fascias. Anteriorly it is formed by fascia transversalis and posteriorly formed by fascia iliaca. Anteriorly is formed by fascia transversalis, posteriorly by fascia iliaca. So it which overlies the iliacus muscle, and this sheath is asymmetrical here. This sheath is asymmetrical, as you can see here. It is vertical like this. Laterally it is vertical, and the medial it is slopy here. Lateral is vertical and medial wall is oblique and directed downwards and laterally like this. This is a lateral wall and this is the medial wall, you can see. And sheath is divided into three compartments. It is divided into three compartments by the two septas. So you can see here, if you go here, so here is the femoral sheath. It is divided into three compartments. Lateral compartment is occupied by the artery, femoral artery. The middle compartment is occupied by the vein, femoral vein, and the medial one is, this is lymphatic compartment occupied by the deep inguinal lymph nodes. This is a femoral ring. What you can see, this is the femoral ring. Here you are seeing, this is a femoral sheath cut section, you can see, divided into three compartments, and here you can see the medial most compartment is lymphatic compartment. Lateral compartment is arterial, formed by femoral artery. Middle one is venous compartment, and the medial most is lymphatic compartment, formed by, it is occupied by the deep inguinal lymph nodes, which drain glans penis in males and clitoris in females. And the middle compartment is called as femoral canal. It, you can see femoral, you can make out here, femoral ring will be here, and here is the femoral canal, that is the medial most compartment. So medial most compartment of femoral sheath is called as femoral canal. So you can see the femoral sheath like this here, anteriorly formed by transversalis fascia, which is the fascia of anteabdominal wall, and posteriorly by fascia iliaca, you can see, and you can see inguinal ligament there, and here you can see lateral compartment is formed by femoral artery, middle one is venous compartment, and here you can see the medial most compartment is femoral canal. So this femoral sheath is divided into three compartments by two septas, that you can see. Middle most compartment is femoral canal, which is around ½ inch in length and breadth, occupied by a deep inguinal lymph node there, with some connective tissue or loose tissue there, and you can see the boundaries there, that is a femoral canal. It is a medial compartment of the femoral sheath. It is conical in shape, being wide above, that is femoral ring, and I told you it's about 1.5 centimeter in length and breadth. That is the lateral wall is formed by the septa, which separates it from the femoral vein. Medial boundary is formed by lacunar ligament, anteriorly formed by inguinal ligament, and posteriorly you will see pectineal line of pubis. So these are the boundaries of the femoral canal, anteriorly by inguinal ligament, posteriorly by pectineal ligament, laterally by septa, medially by lacunar ligament. And this femoral canal is prone for hernia. Some coils of intestine may protrude through this potential space and may come out through saphenous opening here and cause a femoral hernia. That is the animation showing the hernia here. Coils of intestine may go through this femoral ring and they may be occluded and they may be necrosed. There will be gangrene of this intestinal loop because of the occlusion of the blood supply to it. Again we can see femoral sheath here. That is the femoral sheath. A funnel shaped sleeve of the fascia is on 3 to 4 centimeter, covering the upper 3 to 4 centimeter of the femoral vessels like a sleeve. Anterior part is formed by fascia transversalis, whereas the posterior wall is formed by, that is, fascia iliaca. You can see there, posterior wall is formed by fascia iliaca covering iliacus muscle, and you can see it is divided into 3 compartments by 2 subtaes. The lateral compartment is occupied by the artery, and you can see lateral wall is vertical, whereas medial wall is oblique, directed downwards and laterally. You can appreciate these are 2 septas. So it divides the femoral sheath into 3 compartments. The lateral is arterial compartment occupied by femoral artery, and just above there you can see femoral branch of genitofemoral nerve. The middle compartment is venous compartment, and the middle compartment is known as lymphatic compartment, and that is called as a femoral canal. So what is femoral canal? It is the medial most compartment that you can see. That much is the conical femoral canal. So upper part is wide, lower part is narrow, around roughly 1.25 to 1.5 centimeter in breadth, and the length. It is occupied by deep inguinal lymph node, and also called as lymph node of Rosenmuller or lymph node of Cloquet, which drains glans penis in males, clitoris in females. You can see there the boundaries of this femoral canal we have already seen. So medially lacunar ligament, anteriorly inguinal ligament, laterally you can see septum, and you can also see some inferior epigastric vessels there. So this extraperitoneal tissue may herniate or cover the femoral canal. So this is about femoral sheath, and that is femoral fossa, the lymph node of Cloquet. You can see that is the content of femoral canal. You can see it drains glans penis in males, clitoris in females. Or sudden groin pain with swelling. So how do you diagnose? It is done by clinical examination involving inspection, palpation, percussion and auscultation, and a USG of the abdomen is preferred to establish the diagnosis and distinguish it from the inguinal hernias. So treatment is surgery. It can be done by open or laparoscopic surgery. So what is femoral hernia? The abdominal muscles are usually strong enough to keep our intestines and organs in their proper place, but sometimes, however, due to increase in intra-abdominal pressure, they may become lax. So these are some causes of femoral hernia: childbirth, heavy lifting which increase the intra-abdominal pressure, chronic constipation. It may be due to tumors, prostatic tumors, uterine tumors, anything which compress the rectum and anal canal. And chronic coughing, the COPDs, bronchitis, bronchiectasis, tuberculosis. So with repeated coughing, there is increase in the intra-abdominal pressure. So what are signs and symptoms? Person usually come with the swelling in the groin area or the inguinal region. So it may be a swelling or swelling associated with pain and redness that indicate gangrene of the intestines. Patient may present with stomach pain. Here you can see these are the contents of the abdomen there. Due to the weakness of the abdominal wall muscles, that is the intra-abdominal wall muscles, and with the conditions which increase the intra-abdominal pressure, there may be herniation of these bowels into the femoral canal, causing femoral hernia because of the lax femoral ring there and laxity of intra-abdominal wall muscles. They may enter there. You can see that is the femoral hernia. So patient will be given local anesthetic injections. Or they may go for general anesthesia. So here, before surgery, the surgeon will take an incision along the inguinal ligament, because inguinal ligament forms the anterior boundary of this femoral ring or canal, femoral ring, and they will reduce the hernia and put a mesh to strengthen the abdominal wall, and it is closed by steri strips.